Hey, what's up, everyone? My name is Julie Reynolds, aka Nurse Jar. In this training video, I'll be demonstrating how to perform the 2022 Prometric testable skill provides the resident with hand and nail care. Now, keep in mind, for testing, this skill is performed on a live person. For training purposes, I'll be demonstrating using the mannequin. So let's go ahead and get started. Hi, Mrs. Jones. Good morning. How are you? Awesome. My name is Julie. I'm your CNA, and today I'll be providing you with hand and nail care on one hand, okay? All right. I just want to make sure your bed is in a low safe position, and it is. Your bed wheels are locked. I'm going to give you your call light in your left hand. Okay, just press that button if you need anything. I'm going to provide you with privacy by closing your privacy curtain. There we go. Mrs. Jones, before I go wash my hands and gather my supplies, is there anything I can do for you? All right, Mrs. Jones. Washing hands. Now what I'm going to do, because most Prometric test sites will have all the supplies necessary to perform the testable skills at the bedside, I'm just going to bring my overbed table next to the supplies and start gathering them. The first thing that I'm going to gather is going to be a towel, because I'm using this towel as a clean barrier for my table. Then I'm going to collect a wash basin, lotion, and soap. So I have my wash basin, the soap, the lotion. I'm also going to gather an emery board or a nail file and an orange stick or a cuticle stick. And as you see, I'm lining these items up in the order in which I'm going to have to use them. I'm going to gather 2 washcloths, okay, one to wash the hand and one to rinse the hand. I'm going to gather another towel. This is to dry the hand, and 1 pair of gloves. So I have all my items organized on my overbed table in the order in which I'm going to use them. This will help me to remember what step comes next. Mrs. Jones, I have all of my supplies. What I need to do right now is go fill up the basin with some water, okay? Is there anything I can do for you before I do that? Okay, your bed is still in a low safe position. Bed wheels are still locked. You still have your call light in your hand. Just press that button if you need me before I come back, okay? All right. Okay, guys, so when filling your basin with water, remember this skill is performed on a live person. So you want to make sure that you put enough water in this basin so when you submerge the live person's hand into the basin, the water is covering their hand, okay? So if you just fill it like to the 2 mark, the 2 mark is like right here, okay? That should be enough water to cover the person's hand. So I filled my basin with water. Now, before you place the live person's hand into the basin, you need to make sure that you test the water first, and then you have the resident to test the water. You can test the water at the sink while you're filling the basin. Just be sure to make sure you verbalize that you're doing that and you speak loud, okay? You can test with your finger, with your wrist, with your elbow. You can even test with the gloved finger, okay? Hi, Mrs. Jones. It's me, Julie, your CNA. I filled the basin with water. Now what I'm going to do is just test the water with my wrist. Ooh, that's nice and warm. That feels good. All right, Mrs. Jones, I've tested the water. Now I'd like for you to test it to make sure it's comfortable for you. At this time, the live person will stick their finger or their wrist into the water to test it. It feels good? Awesome. Okay, Mrs. Jones. I'm going to go ahead and raise your head of bed to a high Fowler's position, okay? So before I put on my gloves, I'm going to go ahead and raise the resident's head of bed to a high Fowler's position, okay? Are you having a good day, Mrs. Jones? Awesome. That's nice to hear. Okay, is that comfortable for you? Great. Okay, I'm just going to put on my gloves, Mrs. Jones. Okay, and I'm going to move this overbed table, this way towards you. I'm just going to move everything over here. There we go. So the basin can be near your hand. Okay, I have it lengthwise so the person's hand can fit comfortably into the basin. Okay. All right, Mrs. Jones, I'm going to go ahead and place your hand in the basin. Now keep in mind, this is a mannequin, okay? So her hand is not going to fit into the basin, okay? So I'm just going to leave her hand like this. The live person, their hand will actually be in the basin in the water, okay? So while the live person's hand is soaking in the water, I'm going to take my first washcloth and prep it. I'm just wetting it, squeezing it out. I'm opening it up, applying soap, getting soap all over the washcloth. I'm going to fold it back in fours. Now I'm going to support underneath the person's wrist and lift it up from the water, okay? Now I can start washing the person's hands. Washing in between the fingers, and you need to make sure you get that washcloth in between the fingers. The NAE will be positioned to where he or she can see that, you're cleaning in between the fingers. Mrs. Jones, I'm going to clean each individual finger and nail now. There we go. Okay. Now that I've cleaned her hand, fingers and nails, and in between the fingers, I'm going to lay my washcloth on the side of the basin. I'm going to get my second washcloth, okay, wet it, rinse it out. I am not going to put soap on it. And then I'm going to rinse her hand in the same manner that I cleaned it, okay? I'm rinsing in between your fingers. There we go. And each individual hand and fingernail. There we go, all rinsed off. Now I'm going to place this basin. An important step to remember is that once you raise the person's hand out of the water, you cannot stick it back into the water, okay? So that's why while their hand is soaking, I like to get that first washcloth prep, the washcloth that you're going to put soap on. Okay, now what I'm going to do is move the basin away, and I'm going to place the resident's hand on the towel, okay? And of course, the live person's hand would be able to sit down or place it with palm down, okay? Now what I'm going to do is go ahead and dry the hand, palm, and then I'm going to just take one leaf of the towel to dry. I'm sorry, I have that in your way, okay? I'm supporting underneath the wrist joint, have one leaf of the towel to dry in between each individual finger, okay? And then drying the hands and each individual finger and nail. There we go. All right. Now what I'm going to do is get my cuticle stick, and I'm going to get up close to the camera so you all can see, okay? So the cuticle stick or the orange stick has a pointy side and then it has a beveled side, okay? You'll want to use the side that's beveled, not the pointy side, okay? So now I'll clean under each individual nail, and then I will, if there's any dirt, right, I'm going to just put it on the clean barrier here, right? There we go. And now I'm going to file each nail. And of course, you'll be telling the resident what you are doing. So I'm filing each nail. There we go. And now that you're done with that, trash can's right here. So I'm just gonna throw those 2 items away. I'm gonna get some lotion, rub it in between my gloved hands to warm it up, okay? And then I'm just going to place lotion on the resident's hands, but do not place it in between the fingers, okay? All right, Mrs. Jones, I'm just gonna get the excess lotion off your hands now, okay? And you can use the same towel that you used to dry the person's hand to remove any excess lotion, all right? So now what I'm gonna do is I'm going to go empty, rinse, and dry my basin. Okay, Mrs. Jones, I'm gonna go empty, rinse, and dry my basin, okay? You still have your call light in your hand, your bed is still in the low safe position, and your bed wheels are still locked. Is there anything I can get for you before I leave? Okay, I'll be right back. So now you'll go to the sink, you'll empty, rinse, and dry. I'm emptying the basin. I'm rinsing the basin. I'm emptying the rinse into the sink. And now I'm drying the basin on the inside and outside, making sure I get it nice and dry. Hi, Mrs. Jones, it's me, Julie, your CNA. I'm back. I just washed out your basin. Now I'm going to place the lotion and soap back into the basin and place these items back into storage. I'm going to remove my linen, making sure it does not come in contact with me. I'm going to dispose of my soiled linen into the soiled linen hamper. Now, if you used a chucks for the clean barrier, please be sure to dispose of that chucks into the waste bin and not the soiled linen hamper, okay? Now, I'm going to remove my gloves without contaminating myself, so I'm making a C. I'm grasping in the middle of my palm, pulling the glove off, balling it up in one hand, taking 1, 2, or 3 fingers. I usually just use 2, placing it underneath, pulling it over the other glove, and now I'm going to dispose into the waste bin and immediately verbalize washing hands. Okay, Mrs. Jones, I'm gonna take your table, okay, and I'm gonna place it back here. All right, Mrs. Jones, would you like to stay seated in a sitting position, or would you like for me to lower your head of bed back down? Lower it back down? Okay. So it's really important that you check with the patient's preferences during testing, okay? Especially if you have to, raise the head of bed, okay? Just ask the person if they'd like for, to stay in that seated position or lower it down. Prometric is really big on patient preference. All right, you're okay? Awesome. All right, well, I'm all done, Mrs. Jones. Is there anything else I can get for you? Okay, would you like for me to keep your privacy curtain closed, or would you like for me to open it back up? Open it back up? Okay. So I'm going to open your privacy curtain back up so you can see. And I'm just going to make sure that your bed is still in a low safe position. Bed wheels are locked. You still have your call light in your hand. Again, if you need me for anything, just push that button, okay? All right, Mrs. Jones, well, you have a good day. All right. Washing hands. And before I say skill complete, I'm going to wait a few seconds just to go back through, the steps that I did to make sure that I did not perform any steps incorrectly or I did not omit any steps. Once I feel good about my performance, I'm going to say washing hands, skill complete.